Sure. Talking about birth control can be an uncomfortable subject for both parents and their children, but it's an important conversation to have. The medication has health benefits beyond pregnancy protection.
So we asked our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota here. Good morning.
Good morning. Thanks for having me.
Of course, and this is a pretty important topic, and you have some advice on how to actually handle this because it's about so much more than just preventing pregnancy for so many young women.
Absolutely. So there's definitely other things to talk about other than just preventing pregnancy, like you had mentioned. For kids who have, for girls who have periods that last a long period of time or have exceedingly heavy flow, it can be very helpful just to help regulate those periods.
Go on.
Absolutely. And then secondarily, some kids who have profound acne, they use birth control or the pill to help manipulate their skin and prevent other reasons for needing to be on different medications.
Yeah.
So those other reasons are a real nice way to get your child on birth control without having to have that conversation about pregnancy control. But at some point, parents are going to want to have that conversation.
Right. It is a backdoor way to be on medications or therapies without having that conversation, but we really want to encourage families to have that conversation.
When does that happen? What's the right age?
Yeah, I think if you're really having a conversation about birth control, making sure that you're starting that from a pretty young age, from their first boyfriend or from their first girlfriend, really understanding, hey, these are aspects of relationships that we want you to be thoughtful
of. Are you finding it's earlier now than maybe it used to be?
Yeah, I think certainly guiding girls to be on any type of hormonal suppression before they're in relationships has been happening more and more. So it does then create a burden for families to try to figure out how am I going to enter into this other conversation.
Well, yeah.
So it does
you feel
put
like
that up
do
front.
You want to talk about that with a 12-year-old? Do you feel like
you have to? But you have to, right?
Okay,
so
what about when you're in the office with the pediatrician? Because I imagine you're going to want to try and find the best birth control for them because they can have so many different side effects too.
Yes, so aside from the pill, there are lots of other modalities to think about for birth control, both for actual protection for being pregnant and other modalities for hormonal suppression to relieve the periods in some way. So they can be anything from the pill to a shot to something that's implanted to a ring that you place up into the vagina. So there's lots of different modalities to think about. And each one really has its own side effect profile and its own risk and benefit ratio.
Do you see one method is more popular with the younger teens than others?
Yeah, I think it really is more person-to-person specific. There's been much more of a push to think about using an IUD earlier.
More of a long-term
solution. A long-term solution.
You don't forget to take it.
Right, it's much more reliable, but it's more invasive.
We're talking about girls here, but I hope we can do another segment where we talk about the conversations we have with boys, too.
Absolutely,
this is
would love to.
It's not a one-way situation,
No,
for
it's
sure.
not.
All right, very good. Dr. Gigi, thanks for coming in.
Thanks for having me.
Well, nobody wants to